Okay, hello, my name is Caitlin, and I am a social worker at a hospital in London, Ontario. My role covers multiple departments, including the Bleeding Disorders Clinic. To offer some transparency, I am still learning about hemophilia and what it means to have a bleeding disorder, but I do have several years of experience in the field of mental health. Therefore, this will be the focus of today, along with the topic of avoidance. This is a literature review presentation, and therefore any information shared today will be cited. I did not conduct or participate in any of the studies shared today. Also, before I get started, I want to acknowledge that we all come with our unique experiences, which may affect comfort levels with certain topics. Again, to offer transparency, I do discuss my past work experience around suicide prevention. And when talking about avoidance, we will briefly review behaviors like substance misuse, self-isolation, and intrusive thoughts. I am always open to feedback, and I will provide my contact information at the end of this presentation. I will also provide community supports at the end if needed. So to get started, here's a bit about myself. I received my undergrad degree in psychology at the University of Western Ontario. Following this, I worked at a local mental health care hospital while obtaining my Master of Social Work degree at the University of Windsor. Some of my more recent experiences regarding work include working with a team to implement the Zero Suicide Initiative. This is a project that encourages every patient to be screened for suicidality. This initiative has definitely guided my practice as a social worker, as I encourage open discussions around suicide prevention and safety planning. Following this, I worked as a therapist for first responders. I offered psychoeducation group sessions and provided cognitive processing therapy and cognitive behavioral therapy in individual sessions. Finally, as mentioned, I am a social worker at a hospital in London, Ontario, mostly in outpatient areas, including cystic fibrosis and bleeding disorders clinics. But I also assist with social work coverage for inpatient medicine units. So now introducing the agenda. Psychoeducation will be the focus, and this involves the sharing of mental health-related information and treatment options. Today, we are going to focus on anxiety, avoidance, statistics, types of behaviors, and evidence-based coping strategies. So to start with statistics, research conducted and analyzed by Ellen Stevenson in 2022 indicated the following key findings. So more than 5 million Canadians aged 15 plus, which is about 18%, met the diagnostic criteria for a mood, anxiety, or substance use disorder in the previous year. Additionally, more Canadians met criteria for a mood or anxiety disorder in 2022 than in 2012. And this was shown to be highest among women aged 15 to 24 years old. Despite recent rises in substance-related deaths, the prevalence of substance use disorders did not increase from 2012 to 2022. And more than 36.6% of those with one of these mental health disorders reported unmet or partially met care needs, which we'll look further at in the next slide. So this table here shows the percentage of unmet needs in regards to mental health care, specifically for those who meet criteria for a mental health disorder. This shows that many people, specifically 30.5%, reported needing more counseling or psychotherapy than they had received. So today, what I hope to assist with is the information sharing piece. So as shown here, 17.7% of people who met criteria for a mood, anxiety, or substance use disorder reported needing more information on mental health, such as the problems, treatments, or available services. So in saying this, to initiate that information sharing piece, we are going to review the main topic for today, which is anxiety and avoidance, including the relationship between the two, specific examples, and relating coping strategies. So let's break this up a little bit and start with anxiety. This is characterized by feelings of tension, worried thoughts, and physical changes, such as dizziness, sweating, increased heart rate. There is a difference between anxiety and fear, but people often use these terms interchangeably. Anxiety is considered future-oriented and is often a response to an unknown threat or a specific thought, while fear is often present-oriented and focused on a known external danger. It is key to acknowledge that short-term, mild anxiety can be beneficial, as it is our body's natural automatic reaction to a potential stressor. So for instance, anxiety may increase when a deadline is approaching, and as a result, it may then improve alertness and concentration, but too much anxiety can negatively affect the ability to focus. Some researchers suggest even reframing this mild short-term anxiety as excitement to then have a more positive approach and open mind. It's also important to remind yourself that anxiety comes and goes. And as quoted by Ivan Nuru, if it's out of your hands, it deserves freedom from your mind too. So as mentioned, anxiety, yes, it can be natural, it can be a helpful response, but when emotional problems linger, worsened anxiety can result. This in turn can have a severe domino effect on people with bleeding disorders. So for instance, if you're experiencing depression and it is untreated, then you may be less likely to do infusions or other health-saving activities. This in turn can negatively affect your overall well-being. Furthermore, anxiety was shown to worsen pain perception for hemophilia patients, along with poor treatment adherence. Therefore, it is incredibly important for one's mental health to be assessed and treated. So this slide here demonstrates how anxiety and avoidance can come into play, resulting in worsened or reinforced anxiety. So for stage 1, anxiety starts due to a particular event or thought. This can initiate a physical response, as mentioned. And as a result, you might try to seek some form of relief. So stage 2, the relief could be the form of avoidance, where you may start to avoid a certain situation, a person, or a thought, as you worry this will worsen the anxiety. Stage 3, at first, avoidance feels like a win, as your anxiety then lessens. However, it is only a temporary solution, a temporary relief, as the root of the problem has not been assessed or challenged. Stage 4, over time, avoidance leads to heightened sensitivity to anxiety. So for example, when encountered by this specific event, person, or thought, your body may respond with more anxiety as an automatic response. This leads you back into the initial stage, stage 1 of anxiety, creating an ongoing loop. So now we will look at avoidance further, including specific examples. But just like small amounts of stress or anxiety can be beneficial, avoidance can also come naturally and effectively. As humans, we often move towards pleasure and avoid pain, which is understandable and often needed for survival. So, for example, if you see a dinosaur in your neighborhood, fleeing might not be a terrible idea. So, yes, there are times when you avoid a situation because of several reasons, and sometimes these reasons are fair. But if this avoidance is hindering your personal growth, or in the long run, making you feel worse, you may find it helpful to be aware of any avoidant patterns and try challenging them a bit. So, regarding the dinosaur, it might be beneficial to first avoid, but then spreading the news and initiating an action plan might be a better alternative than just hoping the dinosaur will disappear. And on the topic of dinosaurs, this comic provides an example of avoidance that may not be as beneficial long term. I encourage you to look into this artist's work further. His Instagram handle is outlined below as ADH Dinos. He did give me consent to share this comic during this presentation. This artist's name is Ryan Keats, and he is from Toronto area, and he showcases several comic art pieces that may offer some validation and a sense of community. So for the remainder of this presentation, when talking about avoidance, we'll be referring to a maladaptive behavioral response to excessive fear and anxiety, leading to the maintenance of anxiety disorders, as defined by Hoffman and Hay. To provide a specific example for the cycle of anxiety and avoidance, we are looking at a financial stressor. So let's say you look in your mailbox and notice mail from your car insurance company. You pay yearly and did not notice that the due date was approaching again. Unfortunately, you do not have the funds right now, which causes intense worry and stress. Now you throw the mail in the drawer to disregard it for right now. And as you forget about the bill, your anxiety seems to alleviate a bit. However, you then eventually get charged a late fee and your car is not insured. This could create more anxiety and stress in the end. So as shown here, sometimes the anxiety-related symptoms are based on experiences, such as I received an unexpected bill, but there is a variety of other avoidant behaviors to also consider. So here we will review types and examples of avoidant behaviors, but this does not include all of them. So for the first one to review is situational avoidance, which refers to avoiding specific situations, people, things, or activities due to worry of the risk. This could be due to past experiences or the fear of future problems. So for instance, you may self-isolate and not hang out with anyone due to fear of judgment. During protective avoidance, you incorporate certain behaviors that you believe offers additional safety. So these behaviors could be linked to obsessive compulsive disorder or OCD. An example could be performing a repetitive activity, such as locking and unlocking the front door. Somatic avoidance aims to limit physical responses that are possibly produced due to stress or anxiety. This level of avoidance could restrict you from doing fun activities that may create similar emotions or feelings. So an example of this could be choosing to not work out or go for long hikes due to fear of physical overstimulation. Substitution avoidance means replacing uncomfortable feelings or thoughts with more pleasurable alternatives. So examples could be misusing substances or oversleeping, as you believe this will reduce the anxiety. And then finally, cognitive avoidance means avoiding specific thoughts. This level of avoidance can be intentional or unintentional. And we'll spend some time to explain this one a bit further with a metaphor. So, trying to avoid unwanted thoughts or intrusive thoughts rather than just allowing them to come and go is like fighting with a ball in the pool. So these thoughts increase worry or anxiousness. So you try to push the ball underwater and out of your mind. The ball then pops back up, so you keep pushing it under the water. Unfortunately, struggling with the ball in this way keeps it coming back, making it quite exhausting for you. However, if you were just to let go of the ball, it would probably float next to you. At first, you may feel like it's a bit too close, or you may not like how close it is, but if you just let it be, eventually it will drift away. And like unwanted or intrusive thoughts, if you take time to acknowledge, process, and let the thought come and go, it may leave your mind quickly and effortlessly, or eventually it will. Overall, it is important to acknowledge that intrusive thoughts are not automatically true or accurate. They can be meaningless, and the less you avoid or react to them, the more likely they are just to float away. So it is important to note that you may have higher likelihood to use avoidance coping if you have the following risk factors, such as nature and nurture variables. So research is finding that anxiety can be passed from parent to child through genetics, but environmental and social factors also play a role. This can include a traumatic experience, resulting in avoiding anything that reminds someone of that experience. Another factor includes anxiety or depressive related symptoms, or if you're just experiencing a higher level amount of stress during a certain period of your life. Additionally, physical or mental health disorders could come into play. So we did briefly mention already at the beginning of this presentation that having an illness can increase your likelihood for anxiety or other mental health related concerns. Additionally, mental health disorders such as OCD, PTSD, etc., can in turn increase your likelihood to cope with avoidance. Another key example of a mental illness that may be a risk factor for avoidance is agoraphobia. This involves fearing and avoiding places or situations that might cause panic and feelings of anxiety. So before reviewing coping and processing strategies, it is also important to acknowledge the difference between active coping and avoidant coping, so you personally know what to watch for in yourself. So active coping addresses the stressor by using resources or skills or supports and uses a problem-solving approach. So for example, asking yourself questions like, what can I control right now? Or what smaller tasks can I complete right now? May help you move forward rather than avoiding or procrastinating. And as a result, by active coping, you may experience a reduction in stress or anxiety in the long term, as you are processing difficult feelings instead of trying to hide them or throwing them under a rug. Ultimately, this also may help build resilience, boost self-confidence, and improve self-efficacy. So while, as we already reviewed, avoidant coping is a passive approach where really you're just trying to disregard or escape any negative, unwanted feelings. In a sense, this can be considered an emotion-focused approach, as you are making decisions based on feelings in the now. In the long term, your confidence, overall mental health, and feelings and self-efficacy may be negatively affected. So now let's talk about what you can do to hopefully reduce avoidance coping and improve overall mental well-being. So first step you can do is evaluating your thoughts to determine the accuracy of them. So as we mentioned, avoiding any unwanted thoughts can often reinforce them to quickly come back. Instead, if you recognize specific thought patterns, start recording them, so externalizing them, and then evaluate and challenge any helpful, unhelpful thoughts, overall anxiety may decrease. Mind Your Peeling, the website cited on this slide, contains worksheets, psychoeducation, and self-care ideas, which is a great resource. So now referring to the piece around evaluating and challenging unwanted or unhelpful thoughts, you can participate in the downward arrow technique. So this involves identifying an anxiety-provoking thought and examining core beliefs around that thought. So for example, a distressing thought could be, I didn't study enough for the exam. So what does this mean? What's the following thought? Well, I'm going to fail. I will then have to retake the course. I will have to relearn materials. So there's a lot going on with just that one distressing thought. The overall purpose of this activity is to break down a distressing thought to then see the underlying assumptions, like peeling away the layers of an onion. This may also help you to detect how you got to the original thought, or whether there is evidence for this thought, or if unhelpful thinking patterns are involved. This can also help to provide insight on where your anxiety is stemming from. Thoughts can happen so quickly that you may arrive to a more extreme catastrophic thought in your mind without even noticing it. Externalizing your thoughts can help to process them and can help you gain insight on where anxiety maybe is stemming from. Additionally, in regards to externalizing thoughts, you can take up the hobby of journaling to further regulate emotions and increase awareness of thought patterns. I have included some journaling prompts here, but you also don't need to follow a certain prompt, and you can just write freely if preferred. But both methods are beneficial. So if you are preferring prompts, there are several self-guided journals on the internet, including on Amazon for purchase. Here are a couple examples of journals that you can purchase: Cheaper Than Therapy by Reading Press or Start Where You Are by Patel. I'm not associated at all with either one of these journals. It's just if you need accountability for journaling, then self-guided journals may assist, as you can then work towards a certain goal, such as even I'm going to complete a page per week or a page once per day. It helps you set those goals and holds you accountable. Another coping strategy may involve seeking a professional in the community, so you can further process thoughts or experiences and enhance mental health knowledge and skills. So some examples of mental health therapy modalities that can assist with further processing and challenging avoidant coping includes, but it's definitely not limited to, exposure therapy, CBT, or CPT. If you are wanting a community therapist, you can ask your family doctor if there is a type of mental health professional attached to the team, such as a social worker, a psychotherapist. Alternatively, you can go to the website Psychology Today and review available therapists in your area. There are a variety of coping strategies, whether it's working out, establishing and maintaining boundaries with relationships, or breathing exercises. Due to time constraints, I unfortunately cannot go through all of them today, but sometimes even just establishing a new hobby or a new routine can be a good start. This is now the last slide to review today. So if you are needing more immediate help, I have outlined several resources and services within the community, specifically Ontario. So to quickly summarize each one, Bounce Back is a free skill building program designed to help individuals aged 15 plus. It is with the Canadian Mental Health Association, or CMAJ. And this program helps to manage mild to moderate mental health concerns. and it can be delivered online or telephone. Connects Ontario is a confidential phone number for health services information. This includes information on addiction and mental health. Their website outlines that you can contact them in several ways, such as there's an online chat, email, text, call, or for a range of resources and services within your community, you can dial 211. This number can also provide you with information on local crisis numbers. Additionally, Ontario now has a suicide crisis number, which is 988. Or finally, if you're in immediate support, please attend your local emergency department or dial 911. Okay, so I really do appreciate that you took the time to listen to my presentation today on mental health and avoidance. As promised, my contact information is outlined on this slide. Please don't hesitate to reach out if you have any feedback, comments, questions, and thank you so much.